So training through a pandemic has been really interesting. I've gotten to work in the emergency department for a month on the front line, seeing COVID patients along with the nurses and with the ED providers who've been seeing them for years. So it's been really difficult and different in every setting to try to navigate this pandemic, to try to learn, to try to feel like you're helping and doing something as a student. It's not always easy to feel like you are making a difference in a patient's life. A lot of times you're just there to learn. So it's been really weird in the beginning of COVID during the pandemic because we weren't seeing any family members. It was really strange just to see patients alone by themselves in the visit. And so that was really difficult to not get to interact with the patient's family or their caregiver in a lot of situations. So as the pandemic's been changing and as people have been vaccinated, it's been really nice to start interacting with family members again and to start to meet the family members and meet more people and their caregivers and their children. It's been lovely to start to go back to some semi-normal interactions with patients and their family members. A big thing that I think has really changed during patient interactions during the pandemic is an openness to talk about mental health. I think a lot of patients are now more willing to recognize that things are hard and it's a difficult time and there's a lot of challenges in everyone's lives. I think people are realizing that they're not alone, that everyone's going through this. The ability to talk about it openly and ask for help and realize when people might need help has been a nice change that this pandemic has brought us. I had a clinical rotation in gynecologic oncology, and this was after a lot of people had been vaccinated. So things started to feel like they were getting back to normal at first. And I had helped a woman post-surgery remove some staples from her incision, and she was she had a surgery that was removing cancer from inside of her. And she was extremely happy to be there. She had finished chemotherapy. She had had surgery. She was in remission and was really excited. And I was just a part of her care to help take some staples out. And after I finished, she was so incredibly excited. She stood up and gave me a huge hug. And I realized it was one of the first hugs I had gotten from a patient because most of my training had been during COVID when everybody was so scared of each other. It was really nice. And it was weird to realize this was like the first patient I'd hugged. And I didn't feel like I was doing such a huge thing for her. I was just removing some staples from her incision. But it was an incredible feeling to feel close to patients again and feel like you were a part of their care and a part of their lives, even just for a moment.